Hi, I am Gina Ruiz and I am a student at the University of Texas at Arlington. Today we're going to discuss peripheral artery disease. The background of this disease is that it affects 15 to 20% of the population, and it does affect the elderly, and they're usually 70 years or older. Peripheral artery disease doesn't come alone. It usually comes with other existing diagnoses, more so vascular concerns. And what is very unique about this disease is that it can be symptomatic or asymptomatic. The various signs and symptoms of the peripheral vascular artery disease is that your toenails won't grow. You can have slow wound healing or no wound healing in your lower extremities. You will have numbness or no feelings at all, loss of sensation in your lower extremities, and you can have necrotic or dead tissue. That is a very late sign. As we continue with the signs and symptoms of the peripheral artery disease, you can have variations in your temperature. If you take the temperature on the lower extremity, it might be different versus on the upper extremity. The blood pressures may vary. These are other aspects of different types of signs and symptoms regarding peripheral artery diseases. The pathology of peripheral artery disease. You have these arterial vessels, and what happens is these clots of cholesterol and deposit in these arterial vessels, and they become clogged and there's no circulation flow. And that's what's happening with peripheral artery disease. This is a little diagram that kind of shows the process and the steps that takes place with your anatomy in more detail. As we continue with the disease process or understanding it very explains here the arteries of the lower and upper extremities narrow due to the lipids. The extremities become narrow due to the lipids and the cholesterol deposits within the arterial walls. And because of that and the blockage of flow, that's basically what is peripheral artery disease. There are various ways to be able to diagnose peripheral artery disease. A medical exam by your doctor and a medical history. There is other ways of testing, such as diagnostic tests that we have. We have the CTA, there's an ultrasound Doppler, an MRA. There's the toe tip exercise. These are just a few ways to diagnose the peripheral artery disease. And if you're looking into peripheral artery disease, other vascular concerns are probably present or around the corner from being present. Let's see. Treatment options, very important. The main objective of peripheral artery disease treatments are to prevent it. That's the key, is to prevent this. Peripheral artery disease does affect the elderly, but it can affect you in your early 40s. So let's get started on this. Let's see. There are two ways to treat it, which is pharmaceutical and modified lifestyle. To continue, lifestyle modifications and changes are important. Stop smoking. If you are obese, lose weight. Monitor your diabetes and control it. These are a few of your blood pressures. If you're going to use medicine, we're going to use antiplatelets, anticoagulants, and also medications to monitor or maintain your blood pressure, or just a few steps pharmaceutical-wise to do that, and maintaining and keeping up with a primary care healthcare physician or a nurse. How to use various diagnoses. When you have peripheral artery disease, you're going to have other problems. These are a few of them. You can have deep vein thrombosis, muscle strains, septic thrombocytopenitis, and in conclusion, Peripheral artery disease, you want to try to prevent it and start maintaining and working on your health early, and also following up with your healthcare provider and learning to live a healthier lifestyle. Thank you.